I'm working on the Psoas major. It's been about an hour and 15 minutes I've been into the
And here we can see the psoas muscle as it runs from the 12th thoracic vertebrae down along the lumbar vertebrae and goes down and attaches into the back of the femur here. And notice how when that muscle shortens, the psoas muscle shortens, it will compress the space between the vertebrae, which compresses and crushes the discs if it's left unchecked. We can also see the quadratus lumborum, which is the muscle that pulls up on the hip bone, down on the 12th rib, shortening the space between the hip and the rib cage.
after treating the rectus abdominis, the obliques, and now I'm into the psoas major. The whole session has been psoas and abdominal wall, creating space between the pelvis and ribs.
Here you can see the left rectus abdominis muscle, the vertical muscle running from the pubic bone to the rib cage. There's also the right one is there also. And then you have the obliques on the left, and that's the external obliques, and underneath the external obliques are the internal obliques. And all three of those muscles, the rectus abdominis, external oblique, and internal oblique, when they contract and shorten, they pull down on the rib cage and up on the pelvis and shorten the space between the hip and the rib and compress the contents
Mark
thereof.
had about a year and a half ago after golfing, had something kind of really be exacerbated in around his right gluteal buttock area. The right leg was long, left leg short, a little about a half an inch.
And here you can see the psoas muscle and the quadratus lumborum muscle inside of that blue circle there. And as those muscles shorten, it contributes to the shortening of the space between the top of the hip and the bottom of the rib, decreasing that space there. And notice that as these muscles pull up on the hip, that will also pull up on the femur and bring the knee and the ankle up off of the ground. And so the weight has to shift in order to compensate for that.
And we have the pelvis and the leg lengths symmetrical. I was telling Mark that when the spine sits into the pelvis and the pelvis is crooked, there's going to be a lot of compensatory reactions. I think creating space between the pelvis and the rib cage has been the most beneficial. He also goes through physical therapy, which is very, very supportive of everything that's going on. We just want to take tension out right now and get him upright over the bone structure so he can oppose gravity more efficiently.
One thing that often comes up is the question of the internal organs and what happens to the internal organs when you're putting pressure into the abdominal cavity. First thing is that number one is you wait until the surface abdominal muscles, the rectus abdominis and the obliques, relax sufficiently to allow you to go into the abdominal cavity without irritating the superficial muscles. Then the organs, an interesting thing is years ago, a few medical doctors who had surgical training became Wolfers, which was the original of the structural integration people. And one of the things they said is that the structure of the intestines is it's a very aqueous area, meaning there's a lot of water in there. And when you put pressure in to the abdominal cavity, the organs move out of the way. The intestines move out of the way of your manual pressure so you can get to the psoas muscle. And here, right at the pubic bone and the iliac crest and the inguinal ligament, the psoas is right there under the surface of the skin anyway, so you can actually get to the psoas very easily right there. So the opinion of the medical doctors who had become wolfers or structural integrationists was that there was no danger in damaging the organs as long as you were very respectful and went in slow and respect the client's limitations.
We're playing the edges. Have been playing the edges all along because the only person that has the ability to let me in is Mark. So we've just been syncing for the last hour and 20 minutes, creating a space. No pain, more gain. After I finish this up here, we'll check the pelvis and the leg lengths.
You can see from the position of the psoas and the iliacus muscle and the quadratus lumborum that working that deep into the abdomen is affecting all of those muscles. So we're getting a major relaxation and lengthening of what we call the lateral lumbar flexion unit. Those are the muscles that flex the lumbar region to the, in this case, the left.
Let's check our work. There's a perfect horizontal. There's not, and I'm gonna take a hard look. The medium malleolus are level. Spines are level. Rib cages are level. I also often see many people that have a short psoas will also have shortening of the neck flexors. They kind of go hand in hand. Got you. I'm real pleased with everything. With the leg length that was really off. Got that very symmetrical. I expect that you're going to see a remarkable improvement in the way you swing off and less stiffness.
Excellent.
All right, man. I'll see you. Happy coming.
Okay.
Yeah.
Thank you, sir.
Yeah.